I'm Devin Whiting at the Arirang News Center, and we're breaking into our regular programming to bring you the latest briefing from the South Korean health authorities. That should start momentarily. Let's go to the site and listen in. When that does begin, we will go straight to it. In the meantime, we understand that the infection in Itaewon has expanded to a 4th degree from the original infection, so we'll hear them talk about that now.
So with regards to COVID-19 and the status in Korea, I'll update you on it now. As of May 17th, there has been 13 newly confirmed cases, and the total amounts to 11,050. And of these, 1,167 people are imported. And there has been 37 more people discharged. And now 89.5% have been discharged in total, and there are 900 being treated. We did not see additional case of deaths yesterday. And yesterday there were some suspicious cases reported, and we have carried out tests for 7,008 cases. Of the 13 newly confirmed cases, 7 were imported and 6 were related to community spread. For people coming in from abroad, we believe that 5 people were coming from US, 1 from Europe, and 1 was from Kuwait. And for the community spread, we saw 6 newly confirmed cases. And with regards to the club-related cases, there were 5, and 1 was in Daegu region. And for that case in Daegu, this was actually found as to be positive when we were carrying out the test previously. And for the club-related cases, they were all the contacts of the previously confirmed cases. And as of May 17th, 10 a.m., we have seen 2 additional cases related to Itaewon Club. And in total, there has been 168 cases related to this. And we have seen the order from Seoul, Gyeonggi, and Incheon region. And we see that 89 people were the visitors to the Itaewon clubs, and others were related to the contacts, such as family members or colleagues. And in terms of the age groups, 20s were mostly affected with regards to Itaewon club-related cases. And for the Central Disaster and Safety Countermeasures Headquarters are asking people who visited Itaewon clubs, bars, or any related areas from April 26 to May 6 to be tested at the screening centers. In particular, for if you are residing in after-school institutes or cafes or other places such as schools and religious services where a lot of people could visit, you could have a higher risk of transmitting the infection, so we ask you to especially be tested. And for people who got the testing done before, even if you were tested negative, you could see the expression of the infection within the 14-day latent period. So if you're in home quarantine, please make sure that you are following the rules. And even if you're not, please make sure that you're minimizing contact with others and following the rules on personal hygiene, such as wearing face masks. And within the 14-day latent period, if you see any symptoms, we ask you to be retested as soon as possible. The Central HQ and the Defense Ministry are also doing the test for the military officials so that we can prevent any transmission within the military offices. And starting from May 18th, we're going to carry out the test for all of the soldiers and military officials. And for the next 8 weeks, testing will be done. And we are also going to do the testing for around 6,300 people on an annual basis. So it is getting hotter, and there are a lot of cases where people are refraining from wearing masks. However, this would not be an effective measure, so we ask you to wear the face mask in a proper manner. And when you're wearing face mask, you should be covering your mouth and nose fully, and you should make sure that it is in close contact with your face. There are some people who sort of half cover your face or do not cover the nose while only covering the mouth, and this is not the proper way to wear it. And before wearing the face mask, please make sure that you are washing your hands or using disinfectant so that you do not contaminate the mask. And when wearing masks, please make sure that you are not touching it because you could be infecting it when you are touching the mask. And after using the mask, make sure that you're not touching the front side of the mask when you're taking it off. And also, if you're putting tissues inside of the mask, it could actually lower the effectiveness, so you have to take caution. And when you're wearing face masks as well, please refrain from touching your nose, eyes, or mouth because you could increase the risk of infection. So it is more important for you to wash your hands. And also, with regards to the Itaewon related cases, there were some cases of contact in the after-school institutes or bars. So we are asking people to refrain from having gatherings or visiting closed and confined spaces. If you have to visit these places inevitably, please make sure to keep 2-meter distance, wear a mask, and make sure that you are washing your hands frequently and refraining from touching your eyes, noses, or mouth. And also for the elderly people, the pregnant personnel, and those with chronic illnesses, you are at a higher risk, so please refrain from visiting closed or confined spaces or crowded places. And if you do have to visit, please make sure that you're wearing face masks. And for clubs and bars and other closed spaces, if you have come in close contact with others and if you have symptoms such as fever or respiratory symptoms, please make sure to call the clinics under your jurisdiction or the 1339 hotline so that you can go to the screening centers to be tested. And if you have anyone around you who are confirmed, please make sure to visit these screening centers as well. And that'll be all.
And that'll conclude our coverage of this briefing. Now, there's another one scheduled at 5 p.m. Korea time. We'll bring that one to you live as well. Thank you for watching.